Thank you for joining me again on my YouTube channel. Please share it and subscribe. This is Dr. Bar, and today I'm going to be talking about some of the medications that have been redirected, that we know that they existed for years and years, that have been used for other things, but are now redirected through computer intelligence and research to be used for COVID. So none of the treatments so far has been like, there's no cure for COVID, as they say. There's none of the proper regimens that have been like saying, like FDA giving us use this, and that for COVID. So to put things in perspective, we see about 80% of the patients that get diagnosed with COVID. So mild and moderate cases, we see them, we do a house call, and we treat them at home most of the time. And only 20% of the people will get into trouble. 15% will end up in a hospital with low oxygen, and that's what we monitor for you at home. And only 5% will be maybe in severe condition on a ventilator and might be really in dire situation with COVID. So to put it in its perspective, we have treated about 80% of the COVID patients at home. And in our practice, basically, we see those 80% of people that are diagnosed positive, that have mild condition or moderate condition, and we try to prevent them from becoming the 20% that ends up in hospital. So these are the things that we have been using. I'm recommending things. I'm not saying this is the cure of COVID. I'm just recommending things that we have used on patients and we got some good results. And this is my experience. So redirecting some medications, I love this. Melatonin, it's a hormone. It's a natural medicine that you all know you take for sleeping. However, with modifying the doses and under my supervision, we've used melatonin because we found, like in research, it's an immune modulator. It reduces the cytokine storm, which is the severe phase of COVID. It also helps with the sleep that kind of sometimes it's an issue with COVID-19. And actually, there's a study that showed it reduces the rate of positivity. So if somebody's at home, they don't turn positive with COVID, which is great. So it has some protection, binding of the virus is blocked maybe, and preventing the inflammation from the virus. Another one that is really interesting is the naltrexone, which is a medication discovered in the 60s, have been used for addictive medicine. We have been using it for low dose naltrexone for fibromyalgia, chronic inflammations, chronic pain, a lot of autoimmune diseases. So now we know we can compound it as well. So it's a compound, and I need to write a prescription. We can compound it for the patient, and it's amazing as well, like how people have responded to that, because reduce the inflammation, reduce the risk for cytokine storm, reduce the oxidative stress that happened with the COVID, and also reduces a lot of the pain and the suffering that happens with COVID sometimes. So very safe, low dose naltrexone, minimum side effects. We've been using it, we compound it, and we get the prescription to you. Another one that's interesting is the azithromycin. You all know it as the Z-Pak, has been redirected, meaning like the use of it has been changed. We know it's an antibiotic, but also we see that it has some benefits of using it for COVID patients. Another one that's interesting is using the zinc with the quercetin and ECGC. That is how it works. If you use them together, it blocks the virus. It's not just zinc alone. I know people sometimes took high doses of zinc and started having upset stomach. So I really would like to make sure your dosage is properly. Other things that I've recommended for patients, of course, aspirin. We've recommended some of the licorice, and some antiviral, like using certain teas, the cinnamon. These are some herbs that we've used them, which were really, really good. Other than the infusions, the vitamins, the glutathione, the antioxidants. There are a lot of things that we can do to reduce the symptoms and help you during this infection. So please visit the rest of our website where we talk about COVID treatment, and call us, ask questions. We're there to support you and help you, and also to prevent the infection in your family. Thank you very much. So this is just a quick episode that I wanted to talk about how some medications have been redirected to be used for COVID, and we're using those on our patients, and we're very blessed to have good results. So far, we have over 1,392 charts that we have treated since the beginning of this pandemic last year, And we have treated mild to moderate cases at home. We prevented patients from going to the hospital. Hopefully you'll have an easy infection with COVID. If you're watching this, probably that's what is happening, that you need to see us for the visit. And I hope we can help you, whether it's via a home visit or consult on video. So please stay safe and follow the directions. There are other videos to look at, please. And stay safe, stay hydrated, and hopefully we can help you to bridge that stage and recover soon. My next video, I'll be talking about the long COVID, which is the residual effects that we have seen with patients that have had COVID and have not recovered, right? Maybe within, we say about 2 weeks, and on average, people get better. But the truth of the matter, it takes 2 months for a patient to recover on average from COVID. So if there's an extension more than 2 months, I'm going to be talking about the long COVID. We've been trying to treat patients. We are developing protocols to help patients that have the long haulers or the long COVID or whatever, they're going to come up with a name. But we've seen patients that are struggling through this for months later. We do draw labs. We do x-rays at home, so you don't have to go to the hospital, and we help you recover at home. So thank you again for visiting my YouTube channel, and I hope this was helpful. Please share it and please subscribe. Thank you. It's Dr. Bar.